Today we had all the EMS providers in the state come down and visit with the legislators. We do this once a year at the Capitol. We've really tried to educate the legislators that we're not only public safety, but we're healthcare providers. And so it gives us an opportunity each year to speak to them about what our needs are, our workforce development needs, funding needs, those types of things. So that's why we're here today, is to really express what our needs are in our industry here in Mississippi. We're like any other healthcare provider. We have a workforce shortage right now. We're trying to recruit people to come into the EMS industry. It's a good career. You can start as an EMT and go to an advanced EMT and then a paramedic. Nationwide, there's a paramedic shortage, and of course there's a paramedic shortage in Mississippi. The pandemic didn't help us. We were like any other healthcare providers. We lost a lot of people during the pandemic that decided to get out of the career, and so we're having to recruit those people back into the career and get high school people interested, college age people interested to come into this career. Well, we're talking to the legislators this year about treatment in place. A lot of people don't realize that ambulance companies, we do not get paid unless we transport a patient. So if we show up at your home and let's say you're diabetic, we need to give you glucose, or you have another injury and we use bandages and such, and so we'll provide all that care, but we're not paid for that. And so we're actually working with the legislator this year to speak about what we call treatment in place to get reimbursement. But when we don't transport a patient, a lot of patients don't need to go to the emergency department, and the emergency departments are saturated right now. So it helps us to be able to get paid, and helps the emergency departments to not bring in patients with low acuity problems that don't need to be there. So that's really what we're looking for today, is to work with the legislature and educate them. A lot of people just do not understand EMS and reimbursement. The legislature was really good to us the last couple of years. They started a program with us through a bill for what's called Upper Payment Limits Program, and so that's money that's brought into the state for our EMS providers. And so they've worked with us, and so we feel like they'll do the same this year.